Hi, everyone. My name is Benita. Welcome. And I'm here excited. I'm excited. I am a licensed psychotherapist, and I founded Christian Wellness Center maybe in 2001. And today we are the largest Black-Brown Christian counseling center in Central New Jersey. And we have individual, family, and grief counseling, psychiatric services, and even life coaching. So a while back, I want to say maybe about 3 months ago, I went for a checkup, and the doctor then surprisingly talked about, gave me this brain health evaluation, I guess because of my age and everything else. And so when I got the results back, it came back that I had mild cognitive impairment. And guess what? I was shocked about it. Like, what? Like, I know I had a little bit of brain fog once in a while, but mild cognitive impairment? The doctor explained that it was just normal. He said, Benita, don't worry about it. Don't freak out. It's okay. And I'm like, yeah, okay, right. It's okay. But then what he did was that he explained how his protocol and how important it is to address the issues right away. And so he gave me this evaluation, and then he started talking to me a little bit about his program, and he talked about the way his program is set up, that you need a loved one or somebody to support you to go through it. And I'm like, okay. And then I asked him, well, what happens if you don't have a loved one? Like, how do you use this your program? And you know what he told me? He said, well, you can't be a part of it. And if you know me, that just didn't sit right. And so I said, well, what do I need to do in order for other people to become part of this program? So he talked about, well, you need to go through this protocol, go through the certification program, and everything else. And I did. And so what I've done now is that I've taken what he's taught, the certification program. I'm using my many years of mental health experiences in order for me to now specialize in brain health. And that's such a big, pivotal piece for me, because all these years I was about emotional health, which is good because you need both, but you need both. And so as I began to investigate it and everything else, I was like, I'm looking at the research, and the research is showing that stress impacts brain aging. Okay, that makes sense, right? Stress does impact. It impacts our bodies. So naturally it would impact our brain also. But what I found, which was very enlightening for me, was that for every stressful event, right? Every stressful event equals 4 years of brain aging compared to 1.5 for others. So for us, for people of color, every stressful event equals 4 years of brain aging compared to 1.5 years for others. What? And so when I heard that, I'm like, oh man, here we go again. And it started making sense. Okay, yeah, my population, we have diabetes, high blood pressure, and I could see that, but 4 years? And so then I began to educate myself even more. So I'm looking at, okay, how then can I bring this to my community? How then do I help them to understand that there's ways that we can help and maybe decrease those numbers, So I'm here now to raise awareness, to support it, just to talk about it, so that we don't have to fall into this cognitive decline or dementia or Alzheimer's that they're saying that we're going to get because we carry all of this stress in our body. So cognitive aging versus cognitive decline. I want us to make sure that we're clear about that because it's two different things. So when we talk about cognitive aging, come on, y'all, that's just normal. It's normal that as we get older, that some things in our bodies will just start slowing down. No matter what we do, no matter how much we go out and do all of this caring for our body, there's things that will happen that will cause us to slow down. And it's just a gradual process. It happens to everyone as we get older, and it's nothing to be afraid of. Do y'all hear me? It's nothing to be afraid of. It's just a part of life. And so as we age, we may notice that we're a little slower processing. You know, I can't even listen to rap music because it's like, oh God, where's the lyrics? You know, I need to follow the lyrics. Even some music, even some gospel music, where's the lyrics? You know, because my brain is slowing down just a little bit. And then, come on, the forgetfulness. What do we say? I can't remember crap anymore, y'all. Who are Christians out there, y'all know what I mean. When I say crap, we don't remember. And so we're like, what is wrong with me? You know, but it doesn't mean anything's wrong. And people will say, oh, Benita, I got to write everything down now, everything. And so I'm like, yeah, okay. You know, I was in the bed this morning and I was trying to remember somebody's name. And as soon as it came into my memory, what I did was I got a piece of paper and a pen on my bed and I wrote it down so that I'm not constantly trying to remember it. And so we start feeling this brain fog, you know, and later on, not this time, but maybe in another session, we're going to talk about sometimes there's things that will cause brain fog, you know, especially if we had chemo, because chemo could cause brain fog. COVID can cause it also. So there's all of these little things that may be going on and we're not even aware of it. And so, but there's a good lining here with cognitive aging. And I hope y'all can see it, is that it brings wisdom. Hence why at Christian Wellness Center, we call anybody over 60 wisdom keepers. Because in our wisdom now, we are able to make better decisions. You know, we have a deeper understanding of life. My granddaughter asked me the other day, Grandma, would you like to be, I think she said in your 20s or 30s. I said, I don't want to be there no more. I remember those struggles. No, I think I like it right where I am right now. And it's all about embracing the changes and finding the positives in this. So if we look at this forgetfulness and say, oh man, there's something wrong, then we'll miss out on a lot. Now let me explain about cognitive decline, which is different. That's when we look at it, it's a little bit more severe and it impacts our daily function. It's just not about forgetting where your keys are. It's about significant changes in your life that's causing you not to be able to perform everyday tasks. You know, like getting dressed, putting your shoes on the wrong foot. Those are the things that when we're talking about cognitive decline, it's about the memory loss. I mean, totally, you could have glimmers of it, but it doesn't stay. You lose it right away. There's confusion, you know, and there's a commercial where there's this woman, she's just walking around the store and just tapping different things, and her daughter tries to get her attention. That's what we're talking about when it's cognitive decline. And so all those complex tasks you're not able to do anymore. You know, even like the other day I was driving and I guess I had stuff on my mind, and I'm like, wait a minute, how did I get to this spot already? But that's not cognitive decline. That's just me not being aware of where I'm driving. But cognitive decline, where you get in the car and you could be lost for hours. That's cognitive decline. And that's what we're talking about as far as the difference between cognitive aging and cognitive decline. So if you see anyone of your loved ones starting to see that or feeling so agitated, then what I want you to do is seek professional help. All right? Because if we could catch that a little early, then there's medication, there's things that we could talk about. There's a different lifestyle, you know? So brain fog does come in during the cognitive decline. But remember, it can result, just like the other one, it can result from stress, poor sleep, your diet. And so it's important for us to identify the causes to address it effectively. Just before we got on, I was talking to the psychiatrist about this, and he was saying, you know, Benita, make sure that you let people know that when they experience the cognitive decline or their family members, that you make sure that they go into their primary care doctor to get that evaluation, and then your PCP will then set up something like maybe a neurologist or whatever to get tested. And so the brain fog, I call it brain fog management. So if we're dealing with brain fog, there's some things that you can do, some specific things that you can do. You know, make sure you are hydrated. We don't realize how important water is, you know, and so you drink your water, take regular breaks, practice mindfulness. And I often have people tell me, Benita, I can't sit here and meditate. That doesn't work for me. And I'm like, that is fine. You don't have to do that if it doesn't work. But maybe you can look out the window for a few minutes, you know, take a break. Just go sit in some sun. Just do something. I hope she don't mind me putting her on blast. I'm going to put her on blast anyway. So Tiffany, at one point, I think it was maybe a month ago, all of a sudden she wasn't remembering. And I'm like, what? I said, Tiffany, what's going on with you? And if you don't know who Tiffany is, she's my CEO. I said, what's going on with you? And she said, I don't know. I don't know what's happening. And I said, well, where's your vitamin D? And a light bulb went off in her head. Because now, working at home, you tend not to step outside and be in the sun to get that vitamin D. And so then she took whatever she needed to do, went to a doctor, whatever, got her vitamin D, and her brain functioning is much better. So it's little things that we can do to help us with this brain fog. You know, as a psychotherapist, I provide like cognitive tests. I go through your mental history, and I help with any unresolved trauma. Let me tell you about the trauma, and we're going to talk about that next month. But when I was doing this, even when I went to my doctor and I was asking my doctor, when my doctor was doing the evaluation, he didn't take into any consideration my stress. He didn't take into any consideration the trauma. Yep, the trauma that we have, that we hold on to, that cause these PTSD moments, you know, where we have this chronic fear, maybe walking into a store and knowing that these people are going to look at us strange, or, you know, or at work, you know, they say that maybe we're talking loud, our hair's too short, our hair's too long, we have locks, you know, all this chronic stuff that goes on that produces chronic fear in us. And we don't even realize how much that is impacting our brain. And every time that high stress impacts it, we start losing brain cells. And so what we need to do is find different ways to handle this. And so I'm not saying, well, let's go and like I have a quick fix, because I don't. You know, I know what's working for me now. You know, yes, the doctor put me on different supplements, and that's great. And I can feel the difference. I'm monitoring my sleep. because I wasn't sleeping well. I'm exercising even more now. Got a personal trainer, with the encouragement of my daughter. I'm pushing forward in that. And so my community has expanded even more now. All these little things. And y'all, I'm in virtual reality now. And if y'all don't know what that is, y'all make sure what is it, DM me or something, and I will let you know what that is. And it's putting on a mask, and I go into this virtual world. I do my boxing sometimes, golf. I don't play golf well, but I do golf. They have book clubs. They do all of this stuff that they do to help me to make sure that my brain is working. And I notice the difference. I notice that if I don't do stuff like this, I feel like I'm slowing down just a little bit. And that's okay. But if I can do little things to monitor my brain health, I'm going to do it. And I'm going to try to catch any issues early. And that's what we do here. We try to create a personalized plan that may include grief coaching if I find out we got some unresolved grief that's going on that we didn't deal with because we were so strong during that time, for our loved ones. So we didn't take care of ourselves, and we carrying this stuff inside of us. Eating. Now, tell you a little secret. I just ate a bag of pretzels. Now, I do that when I get nervous. And so, but I'm getting back on the horse, So the nutritionist, we have a person who is our care coordinator. So when there's any other services that may be needed, we try to do it all, be holistic, so that you can get the help that you need. You don't have to walk around in this daze. And so I want to just reassure you that there are steps that you can take. It's all about taking small positive changes in your daily life. That's all. You don't have to do it alone unless you want to do it alone. If you want to do it alone, then that's fine. I'm not here to push anything on anyone. All I'm trying to do is make you aware that brain fog can be treated. It does not have to lead into, as we say, they call them mild cognitive impairment or Alzheimer's. It doesn't. If we could catch it in the beginning and distinguish it between cognitive aging and cognitive decline, and then we can work on it, and we can create a better lifestyle for ourselves. So if you or your loved one is just feeling it, any cognitive challenge, I'm here to help. There's a commercial, and I often think about, and I don't know if you've seen it, where she's black, and she's on there, and she's talking about her mom, she knew her mom, how her mom was so vibrant and everything else, and now her mom is slowing down, and she lives in another state, and she says, I need help. I love my mom, but I need help. And that's what we're here for. I love my mom, but I need help. Well, guess what? We're here to help. And so however that is for you, all I'm saying is just send us a line, tell us what your concerns are. If you're going through it with a loved one and you just need some support, just let us know. And we will help you with that also. And that's what the psychiatrist in the office was saying. He said, Benita, so many people are going through this now, especially with baby boomers. He says, maybe you need to have something where there's some support system for the loved ones, for the family members that are going through it. And I'm like, that's a great idea. That's what we're going to do. I know that one comment that I just heard was that how to support a loved one as they're experiencing cognitive decline. And again, my advice is to stay patient with them. Stay patient with yourself. If you're feeling yourself having this brain fog or missing words, do things differently. After I took my test, and he said, I went out and bought a watch. I no longer wear, and if you know me well, I'm an Apple fan. So I took off my Apple Watch, and now I'm using this and a regular watch. And the reason I'm doing that is because I want to make sure we live in a digital world, and I want to make sure, okay, I don't lose the skills, to tell time by looking at a watch. When I write in my journal, I'm writing down the full day, and I'm writing what today is. Little subtle things that we don't even think about. Make sure that their loved one is engaged, in life, in the activities they enjoy. I told one clinician, because the parent wanted, the kids wanted to take something away that the parent loved. I said, that's fine, but make sure you're replacing it with something. Don't just take something away. Replace it. Okay, there may be a time that you may have to take away their driver's license. What are you going to replace it with? Uber? Okay, then do that. But making sure that they always feel that they're a part of life. And so, for yourself, make sure that you're staying connected. And then another question that I see is that if you're struggling with brain fog right now, you yourself, remember the tips earlier. Stay hydrated. Because you know what happens if you don't drink a lot of water? Your brain then is being depleted. And so then your body goes into stress. And then it messes with your memory, messes with your head. Someone texted me last night and said that, they're missing little words. Okay, so your vocabulary you may not be able to grasp it. But maybe now you need to, I went out and got a dictionary. You could do it on the computer, but no, there's something about looking at things on paper. Little things that you can do to help. Make sure you're taking your vitamin D's, all right? Making sure that, and please go to the doctor, all right? And make sure that your vitamin D is up, is on level. And so you could do all these little things just to help you to make sure that this brain fog decreases. And one last thing. When that person is getting on your last nerve, instead of you responding, I would love for you to take a break. I want you to take just a deep breath so that the oxygen will get to your brain. Even if you have to go into the bathroom. And I want you just to take that deep breath so that you can calm yourself down so that the brain then can flow. And if you can't remember, just tell yourself that it's going to come back to me. Just let me slow down. Let me not put my body in a stressful way. And make sure you see a health professional if it really bothers you that much. But stay tuned. I plan on doing this once a month, giving you tips. What I learned, I'm going to share it. You can call the office, 732-873-2777, or look on our website. It's www.cwcnj.org. And you can schedule appointments. You could, whatever you need, I'm here to help you. So just make sure that you stay connected, and I can help support you. Our next chat is going to be on childhood experiences and how it affects the brain, how it affects our brain health. Because we think that all of that stuff we've been through, and on a side note, I don't know many people that have escaped childhood without trauma. So let's talk about it next month. And so that's all I have. If you have any questions, let me know. Other than that, have a wonderful day. Thank you for stopping by.